I invite Dr. Amish Vora to give his talk on preventive oncology.
Thank you so much, sir. I must congratulate sir, you and Dr. Sushil sir for such wonderful gathering and preventing everything. I think that is the motto. And sincerely thank the entire group for tolerating me. Just a small thing which I will, 10 minutes I have been given. 10 minutes is good enough? Okay. So just a small learning in oncology. When we used to do morning till evening conference, invariably what used to happen, initially 9:30 we are very euphoric, and from 9:30 to 12:30 all the sessions get delayed, and by the time 4:30 comes, the last 6 sessions you have to wind up very fast. So what we learned, sir, first 3 conferences we made lot of enemies, because we said if you are given 12 minutes, 13 minutes will switch off this thing. But now we all are used to it. You tell me 10 minutes, I'll finish in 10. You tell me 12, I'll finish in 12.
I give
and
you
that
12.
way, no, I'm just saying, sir. It is not, I'll try to finish early. This slide is changing, this is not changing. Anyway. Preventive oncology, basically 2 broad points. Can we prevent cancer from occurring? That is the first and fundamental thing. And the second thing is, if you can't prevent, can you detect it early? US data says that 40% of men and 37% of women will have cancer during their lifetime. India, we are lucky that we have as close as 2020 consensus, where 1 in 8 male and 1 in 8 female in India will have cancer in their lifetime. Unfortunately, the city where we are staying, the number is going to be 1 in 6. My mistake. Instead of India, please read at New Delhi. This is National Cancer Institute definition, that how do you define prevention? Avoid a carcinogen, that is first. Second, pursue lifestyle or dietary practices. Third, can you take some medicine which can reduce or prevent cancer? And fourth is early detection. The 4 main points about preventive cancer, and there are 37 countries which have adopted these 4 things, and they have found that not only cancer, but there are a few other things, and I'll just very shortly say: never smoking, body mass index of less than 30, physical activity of more than 3.5 hours weekly, and prudent diet. All these 4, if you do, you have 93% reduction in diabetes, 81% reduction in MI, 50 in stroke, and 1/3 of cancer can be prevented for that. These are the various risk factors, known risk factors for cancer. Age, you can't do anything about age. There was a joke that there are many celebrities and singers who die young, and they are prevented from having cancer in their lifetime. It's a joke basically. Alcohol, rest all can be modified. Alcohol, cancer causing substances. Chronic inflammation. There are very few people know about this, chronic inflammation. Any inflammation or a long-standing infection keeps causing DNA damage, and this DNA damage then can cause cancer. Diabetes, hormones, immunosuppression, obesity, radiation, sunlight, and tobacco. We cannot modify age, so I will not talk about that. Alcohol consumption. This question has been asked to me many times, and trust me, breast cancer is one classically associated with increased alcohol intake. Very few people know about this fact. They all know liver का cancer होता है, larynx होता है, oral cavity होता है, but breast cancer with heavy 1.6 times that of normal non-alcohol consuming people. This is, as I mentioned, please cure chronic inflammatory disorders in your body that can prevent cancer from happening. Ulcerative colitis and Crohn's disease are classical examples. There was a lot of hue and cry and lot of talk about everyday low dose Disprin can reduce the chances of cancer. There's still not confirmed things. These are various infections. Please, if you can cure them or if you can control them, you should do that, because many of these virus infections can ultimately lead into cancer. Diet. Loads and loads of India is a GI centric country. Patient को ejection fraction 8% होगा, patient का creat 7 होगा, patient को GERD होगा. First question relative would ask, sir खाने में क्या लेना? That is what we say. We are a GI centric country. There is nothing which has been associated except for low fat diet. Patients suffering from breast cancer, if they had low fat diet, their mortality reduced by that. This is very important. Neither vitamin C nor vitamin E reduces chances of cancer. Please do not overload your patients with multivitamins. Does not help reducing the cancer, which is extremely important. There was a lot of discussion about two main products which I want to talk about. Selenium, one, and there was that, selenium said it's supposed to reduce the cancer, but it is not reducing. In fact, it increases the risk of prostate cancer. If you see that beta carotene, lot of beta carotene supplements were given, and if you see, it increases the chances of cancer. Not only does not reduce, it increases the chances of cancer. Patients with HIV infection, we all know, can have cancer, so we try to control it. According to me, the outbreak of cancer in this world is because of this one factor called obesity. BMI high, higher chances of cancer, and this is in our hand. Very commonly asked question, sir, X-ray, CT scan, PET scan करने से cancer बढ़ता है या नहीं? If an elderly gentleman does one hip X-ray, the risk increases 1 in 37,890. So does not increase the risk. But there is studies in children that multiple PET cancer increases the risk in 1 in 42. So we have to be judicious when we offer PET scan to our patients. This is a completely different ball game, and one of the days in the forum we will discuss genetics of cancer. There is lot of development in that. Few drugs are supposed to reduce cancer: tamoxifen, finasteride, COX-2 inhibitors, and aspirin. There is a very interesting, in prostate cancer, finasteride reduces prostate cancer. This was a very famous and successful trial. But what they found that it reduces the chances of cancer, but it increases the grade of prostate cancer. Those who would have been diagnosed with low grade, Gleason 4 or 5, Gleason 7 plus were very high. And that's the reason finasteride has no longer been recommended. I cannot stress less on this. People do not do this. In countries like USA, in spite of telling 20% of seniors have just adequate physical activity per week. In India, 60 plus, they say that they are very physically active, but they do not do recommended exercise, and this is a topic by itself. 2.5 hours, I say 3 hours of physical activity of moderate intensity. I don't know if any of you know the definition of moderate intensity. Any activity where I pant while talking is considered a moderate activity. That is the way, that is what we call as a brisk walking or moderate activity. Specific cancer prevention: breast, ovary, uterus, colon, cervix and lung. I kept this endometrial. This is the only one, but this is not to be taken. I have been asked this question amongst gynecologists, oncology, that cigarette smoking is supposed to reduce the chances of endometrial cancer, but you all know that smoking causes increase in every other cancer known to mankind. Breast cancer prevention is very important. There is a lot of discussion about surgical prophylactic mastectomy, and again it's a huge topic. Just doctors should be aware that there is something like that goes on. There is no specific for ovarian cancer. This and the next one, if these two are kept in mind, I think today's my talk would be, I'll be happy. Colonoscopy and pap smear are the only two tests which identifies pre-cancerous lesions. Mammogram will identify cancer. ENT examination will identify cancer. CT scan of the lung will identify cancer. Colonoscopy will identify polyp which can convert into cancer. So if you do polypectomy, you avoid cancer. Pap smear, CIN 1, 2, 3. If you diagnose and you treat, conectomy done, patient does not have cervical cancer. These two are extremely important, and I feel, as Chauhan sir mentioned, if we refer to each other these two things, I think we can prevent a lot of cancers in this society, and we should do that. Please, two main things. Kalra sir mentioned about vaccines. Those who have not taken hepatitis vaccine, especially hepatitis B, the quality of life of hepatocellular carcinoma is one of the worst across the world. Take hepatitis B vaccine, do your anti-HBs antibody. If they are more than 10, be happy. If they are less than 10, take a booster dose. Cervical cancer vaccine prevents 6 different types of cancer in mankind, and again this requires a detailed discussion. So my last 2 slides, and I am 8 minutes, general lifestyle recommendations. Avoid tobacco. I think nobody does not understand that. Be physically active. I think we need to learn this. I think one of the time, and I say today, sir, that if this group is ready, I can organize a small marathon for all of us and our family members. Just to begin with, it's a great fun. My wife drags me, and that's why I say that it's a great fun. Maintain a healthy weight. Eat diet rich in fruits, vegetables, whole grains. There is Japan there were 170 people living above 110 years, and what they came to conclusion was that these patients eat the food grown in 5 kilometers near vicinity of their house. 5 किलोमीटर के आजू बाजू में आप फार्म में जो उगता है वही खाओगे. It's a fresh seasonal fruits and vegetables. Limit alcohol. Protect yourself against STDs and vaccinate girls and boys against HPV. Sun is not for us. Regular screening for breast, cervical and colorectal cancer. As doctor, we should know when to do genetic counseling, be aware of that. Be aware when to go for these genetic testing and what to do if the reports are abnormal. Extremely important is risk reducing surgeries, that is mastectomy and oophorectomy is extremely important for all of us going forward. Next 5 to 7 years, whatever field you are practicing, people will come and ask you this question. Last but not the least, if you can't prevent, observe the early signs of cancer so that you can be diagnosed at an early stage and cancer can be cured. Thank you so much.
Very wonderful presentation, Dr. Amish, and I think you are probably the only speaker after Dr. Viveka who finished in less than 10 minutes. Congratulations for that. You are a gentleman always and waited as we had requested you to. You mentioned about, just few questions, you mentioned about obesity being a great trigger for malignancy. What is the trigger? Where is the trigger?
So there are 2-3 things which I have understood. One is that the fat deposition in US patients, as the fat increases, the distance between 2 melanin pigment increases. And because of that, the chances of melanoma increases. This is in US people or people who are hypopigmented. This is a very well-known fact. In India, obesity alters the metabolism of the body, causes some form of inflammatory life cycle in the cells continuously, generates DNA damage, mutations, and as a result cancers. Second important thing, what I have understood in so many years, why is one person obese? 99% because you are inactive. Why are you inactive? You are lazy. And it is a cascading event basically. But BMI less than 30 and reducing chances of cancer has been proven for last 30-40 years.
Another thing that is very well understood, in fact, is the occupational hazard of people working in radiotherapy centers. You have had a very good stint in Tata, and there is BARC there. Have you heard any evidence, any documentation of people having increased incidence of cancers?
Sir, there are 4 colleagues who had cancer. In spite of, these people wear badges, and the moment the exposure increases, plus pregnant ladies will not go there, blah blah blah, all that. 4 colleagues from that department as compared to 2 colleagues from other department. It's too small a cohort for me to finally come to the conclusion.
Any large-scale randomized control trials?
Yes, sir. It has been done, and that's the reason these batches have been developed, because if you cross that, your hazard ratio increases by 2.7 to 2.8%. What it means is that if out of 100 people, say 1 person will get cancer who are not exposed to these radiation, those who are working in that center and change, 2.7 out of 100 will get cancer. So this is what we have seen. There's a very classical this thing, shipwrecking. Alang is an area in Gujarat. आज की तारीख में sir, the average lifespan of an alang male is 52 years. When it is 67 and 65 in males and females in India, now 71 in urban areas, 52. So shipwrecking causes a lot of pollution, and they get mesotheliomas, so common. And it is still shameful. Nobody wants to project at that, but that is what is happening.
I want to ask you this question, and really for benefit of everyone. When we talk of preventive oncology and radiation hazards, hundreds of thousands of X-ray centers in India, in every nook and corner street of our country. We are supposed to have walls with protection, with people coming from, I understand, the agencies, to see whether they are properly protected or not. Are things being done properly? You being an oncologist?
Answer is no, sir. And I'll give you 2 examples. Tobacco causes cancer was known to mankind 40 years before it was published. The tobacco lobby was so strong, they curtailed the evidence for 40 years. Till the time no longer they could curtail, and people came to know about that. Cell tower causing cancer, I was invited on radio, and they didn't broadcast my interview. And they called me and said, "Okay, sir, thoda modify karke aap bologe?" I said, "Nahi, bola theek hai, we'll search somebody else." This happened with me, sir. I raised a very simple, that you say that cell phone and radiation tower does not cause cancer. They said yes. I said, then why do you say that we will not put the cell towers in 4 kilometers of school, hospitals and colleges? I said, what's the need? If you strongly believe that it does not cause cancer, why these restrictions? There was no answer to that. So Finland is the only country where they have very conclusively proven that cell towers causes cancer. And because that, some of these European countries, if you travel for conferences, you realize that phone आसानी से मिलता ही नहीं है, because they are very stringent about these things.
Sir, my last question, but very dear to me. My wife keeps her cell phone below the pillow when she sleeps, and I do it at times, although I keep it little distance.
Don't do it.
Is there a real danger?
Yes, don't do it.
What's the distance?
There is no defined distance, because these things are actually kept from. You have to understand, if I start doing this experiment, I don't have that funds to do these experiments.
I think at least 2 feet.
People who have funds, they will not, sort of come out. But normally it is said that if I am sleeping here and you have a dressing table say 3-4 feet away, keep on the dressing table. हम कोई इतने बिजी है नहीं कि रात को भी अचानक ऐसा करके
But when you are mobile, you carry it on your body
all the time.
Correct, right? So that's what I said ना कि it's choice is yours. मोबाइल बंद करके फिर गाड़ी में पहुंच के सब करना है. We are a mobile crazy country ना मैम. हम लोग सबको लगता है कि नरेंद्र मोदी की सरकार गिर जाएगी अगर मैं मोबाइल बंद नहीं करूँगा तो. That's the price we pay for it.
Dr.
two
Dr.
questions.
Saxena has a question.
Sir, two questions. One, how is white sugar blamed as of today? No sugar, no sugar. Is it true? And secondly, does yoga reverse cancer?
Okay, very interesting questions. Sugar, and मैं हाथ जोड़ के सबको बोलता हूँ, please, and this is, I'm tired, sick and tired because the doctors tell the patient. I'll give this answer in two things, cancer patients and all of us. Cancer patient sugar does not do any harm. Please, stop, anybody, everybody, I'm tired. Mayo Clinic, MD Anderson, MSKCC की website पे लिखा हुआ है कि biggest cancer myth is sugar consumption increases cancer. It's a myth. And this myth started 1965 में किसी ने research किया था, cancer cells isolate किया, उसमें sugar moiety दिख गई तो तब से लगा के भाई ये तो direct feed. Ayurveda doctors they love to say that आप sugar ना मत लो, cancer को starve करो, जिएगा कैसे? Stupidity. But non-cancer में, and again physicians, sugar and salt are the biggest two enemies of mankind. So if you reduce their consumption, 60 to 70% of illnesses would reduce. The second question was yoga. Yoga definitely reduces the chances of cancer. Yoga reduces the chances of side effects of treatment. Yoga, what does it do is increases the length of telomerase enzyme. I don't know if you know the telomerase enzyme called fountain of youth. जितना telomerase enzyme ज़्यादा उतना aging slow and उतना the chances of cancer less.
Does it reverse, say type, say 2 to 1 or people say हमारा disappear हो गया, you know?
बकवास. Cancer में everything else helps. Everything else helps. Only the established treatment cures.
So my question is, अभी आपने स्लाइड में दिखाया कि PET CT से there are more chances of chances 1/42 or something like that.
Children.
In children. In adults?
एडल्ट्स में पेट सीटी का जो सबसे पहले टाटा हॉस्पिटल में पेट आया था तो डॉक्टर नायर ने एक कोई मेटा एनालिसिस प्रेजेंट किया था उसमें दे सेड दैट देयर इज 1.12 as compared to 1 chances of having second cancer after 23 years. Now how to interpret this data, that's why I didn't put that. So what it means, how I look at it, stage 4 cancer किसी को है, the expected life expectancy is 5 to 7 years. I don't bother in the number of PET CT. Curable cancers, we limit. We say कि जब जरूरी है तभी PET CT कराना है. इंडिया में again unfortunately everybody says हमारे डॉक्टर तो बोल रहे थे आपने PET क्यों नहीं करवाया करके. That is again the common thing. So in a patient who is destined to live beyond 20 years, 30 years, you limit the PET CTs of the world.
How frequent should be the, suppose you are monitoring, how frequent should be the
as and when required. As and when required. Why do you want to do? See, for example, breast cancer में, lymphoma में, once a patient is cured, there is no recommendation of PET scan lifetime. We do it. साल में एक बार 19,000 में होता है, 10,000 में होता है, 8,000 में होता है, करा दो ना यार. We should not do it.
And you think PET MRI would be the thing that will replace?
I don't have data of that. I don't have data of that to say. I don't like PET MRI too much. MRI has its own usefulness, but PET CT definitely is better than PET MRI in terms of cancer.
Thank you.
Sir, I just wanted to. Lalit, ask your question.
Sir, you alluded to screening test and you said ENT will only detect cancer if you open the mouth, but not detect the pre-cancer region.
My mistake. My mistake, sir. My mistake.
No.
आप clarify करो उससे पहले. It is my mistake. Leukoplakia, erythroplakia, both can be diagnosed in ENT examination, and you brought out a very important point. Actually, I wanted to stress on colonoscopy and pap smear. इसकी वो enthusiasm में, it is my mistake. In fact, there is a new drug called immunotherapy, and अभी 3 महीने पहले आया है, if you give that, the reversal of leukoplakia is 40%.
In fact, we can quantify. If you have leukoplakia simplex, it is about 3% will go on to become a cancer.
Correct.
If the leukoplakia is erosiva, it can go on to become cancer in about 12 to 28% patients. And if it is OSMF, oral submucous up to 40% will go on to become cancers. So this is very clear-cut known thing.
Right, sir.
Doctor wanted to ask whether vegan diet has any role in cancer reversal.
It's so.
Define vegan. Vegan diet of cereals or natural vegan diet?
Gluten is there, but vegan means no milk or milk products and animal.
No animal products.
There is
They don't have milk.
there is no study relating link to cancer reduction and vegan diet. There is no link of that per se. But yes, there is red meat and colon cancer. There was one study done, 15 years का follow-up था. एक मुट्ठी भर के रेड मीट आपने रोज खाया 15 साल तक, तो आपका चांस कोलोन कैंसर होने का 4 to 5 times increase होता है. That is an established study. एक मुट्ठी भर के रेड मीट every day for 15 years. Otherwise, there is no association.
I think in the interest of time,
Yeah.
we need to wind up. Thank you very much for a wonderful presentation. And honestly, one of the most enlightening talks today.
Thank you, sir. Thank you, sir.
I would request Dr. Bhupender Mehta sir to give certificate of appreciation and a token of gratitude.